Hi, this is Dr. Cruz. Once again, I want to talk to you a little bit more about COVID. There's been a lot more information that comes out. The CDC gives us a lot of information, a lot of new studies that have been ongoing and showing us exactly what's been going on with COVID patients. Now, of significance, I want to point out a few things that are vital, and I won't take up too much of your time, but first of all, there's been asymptomatic patients where they see lung scarring. Now that's significant because we consider a lot of these patients to be asymptomatic, very mild cases, but they can show lung scarring as well. And we've pointed out from the beginning that pre-existing conditions are a big deal with this infection. Yeah, that is a big deal. However, 20% of the young people that don't have any pre-existing conditions are also showing some of these symptoms to last 14 to 21 days. And that's a long time to have an infection and symptoms of this. That's not only the worst thing. I think the worst thing is that some people compare it to the flu, but the symptoms that we're seeing from this infection are much worse than what the flu has shown us. Some of the studies show this. Some people are having symptoms last 3 to 4 months. The lasting symptoms are bad also. There are breathing problems, there's chest pains, there's blood clotting, there's muscle weakness, there's GI problems as well. So there's a lot of things that are going on that are affecting a person's life tremendously over time, even after the initial onset of this infection. Now, how long are the symptoms going to last in some of these patients? For some, it may be weeks. For some, it may be months. For some, it may be a year, especially if you have muscle weakness and you're trying to get that strength back. For some, it may be a lifetime, depending on what organ it affected. If it affected your kidneys or your heart or your brain, whatever it affected, then you're going to have symptoms lasting a lot longer, or maybe a lifetime. We're not sure because this is such a new virus and all these changes are occurring so rapidly. But what I recommend for my patients, now that the flu shot is out, I recommend that they get the flu shot, because the last thing you want is to have the flu and COVID at the same time. COVID affects both lungs, and it's not going to be a very good infection if you get both of those things at the same time. Also, when the COVID vaccine comes out, I would recommend that people get that. That's what I'll tell my patients. Now, when vaccines are given and you get fever, chills, body aches, all that, remember you cannot get the flu or you cannot get COVID from the vaccine itself. You will produce an immune response, and that may give you the fever and the body aches and all of those symptoms, but that's just your body defending itself so that when you do get the virus or you do come in contact with the flu or the COVID virus, that your body has good defenses against it. That's the way vaccines work, and hopefully they'll be very effective. Now, the COVID vaccine may be one or a series of vaccines. I'll go over those vaccines on my other medical channel later on. But for now, I just wanted to stress to you guys the importance of knowing the truth about COVID, knowing that these can be lasting symptoms, knowing that you don't necessarily have to have a pre-existing condition for it to affect you in a negative way, and that you all should try to continue to take care of yourselves. And by taking care of yourselves, you're taking care of others. Guys, thank you for watching, and I hope you guys are safe out there. Wear your mask, wash your hands, social distance, and take care. We'll talk to you next time.